Welcome to the Beauty of Breathing podcast, where we explore the wonders of optimal breathing. I'm Renata Nami, a dedicated mom, entrepreneur, and myofunctional therapist committed to embodying the principles I advocate. Having recently undergone a tongue-tie release and palatal expansion, I'm thrilled to guide you through the transformative journey of embracing the beauty of breathing, effortlessly and through your nose. Let us know how much you enjoy the show by leaving us a review. We are live for another Beauty of Breathing episode today with my dear friend, Dr. Karen Parker Davidson. How are you today?
Good morning. I'm good. It's been a busy day. Still in scrubs. So anytime I get to wear scrubs and my leopard clogs, I'm there.
It's a good day.
How are you?
I miss wearing scrubs. Can't believe it's been 6 years.
It's a good excuse. So anytime they say, come on over and let's play. And I'm like, okay, whether it's in the OR or clinic, I'm there for it.
I love it. We don't wear scrubs in Brazil. And I took all my old scrubs and gave it to my sister. She's literally this week sent me a photo of her wearing scrubs, going to work, which is a non-clinical job. And she was like, oh my gosh, it's so comfortable wearing this uniform.
Right?
I was like, I know, it's great.
In fact, OR days, it's so funny. You throw on sweats and then you go into the OR and, change into scrubs. It's like, what a uniform, right? And of course, wearing, and you get OR hair out. Hair up, so it's a good excuse, right?
Nobody could understand why I dressed up to go to Walmart. Just because I wear scrubs all day long. If I'm gonna get out of the house, and that's a Brazilian thing too. We're gonna put heels on, and we're gonna put a lipstick, and we're gonna, feel good about ourselves.
Should have.
And let me go ahead and introduce you. So today, we are thrilled to welcome Dr. Karen Parker Davidson, RN, founder of the International Society of Airway Function Diagnostics and Therapeutics, and a globally recognized airway clinical nurse specialist with nearly 40 years of experience. Karen has dedicated her career to understanding airway function with a particular focus on the role of the nose and the importance of objectively measuring nasal resistance. She is the creator of Airway AI and the Davidson Maneuver, CEO of MedTech Research, and author, an internationally recognized speaker and educator whose work continues to change the way we understand airway health. And today's conversation is extra special because we're celebrating 5 years of collaboration with Dr. Karen and 5 years since her introduction to myofunctional therapy. It's been an incredible journey of learning, collaboration, and connecting the dots between nasal function, breathing, and the rest of the airway. Karen, welcome to the Beauty of Breathing podcast.
Thank you. It's like Beauty of Breathing. It almost reminds me of the Martha Cortez.
She just came to my mind as I was reading that.
Oh my! And I want to ask you, how exactly did we meet? I know it's February of 2021. You just started Airway Circle. I'm like, this is really cool, and you gave me my first speaking opportunity. And I shared this on the Thursday Night Live, so I won't bore anybody because I can always go back to that. But it was you put me on this platform, and I'm not a big public speaker, so I'll never be a politician. Okay. I will never be a politician. Right. And I at the time, I'm like, myofunctional therapy. I had no idea. I mean, I've been around respiratory therapy, critical care, flight nursing, infusion nursing, all these different things in the ENT world since 2002. So think about that. I'm like at Hopkins, University of Maryland, calling on these big accounts, George Washington University, Georgetown University, the VAs, and I never heard of myofunctional therapy. And I'm like, what is going on here? When I was doing health, and I was working with speech language pathologists, it occurred to me that what they were doing in the home, these exercises, that was myofunctional therapy. So what you do in the dental world is just so important. And I have to say, I was talking to a dentist yesterday. He said, what do you think of taking a myofunctional therapy course. So I'm like, do it.
Yes.
And I want to share some news. So,
Oh,
so I got a little frustrated because I was trying to finish my PhD in business. I thought international business and entrepreneurship. And you and I are very much faithful people. I'm a good
yeah.
Catholic girl. And I always feel like there is this inner voice always telling you something. And usually you're right, kind of that sixth sense. And over time, I was seeing so many different things in the airway world: diet, nutrition, gut. And I had this calling, and I changed my major and my complete focus to functional medicine.
No.
So, so by the end of November, December, somewhere in there, maybe sooner, I will have my doctorate, PhD, functional medicine.
Yay!
And I want to get
I have goosebumps.
and I want to get a nutritional, like a nutritional science certificate, because it's just amazing how this is all integrated. Let me share an example with you. So in functional medicine, we look at the 5 major organs, like the brain, the heart, the stomach, the gut, and the lungs. Now think about that and how it's connected to the nose. If you read in my first book, little shout out, this one,
Yay.
this, Breathe Through Your Nose, Don't Pay Through, was kind of a healthy dose of cynicism of the current medical system. You know, I always felt like, are we given a pill to treat the disease, or are we given a pill and prescription to compensate the symptoms and the effects of that disease? What are we doing here? So it just got me thinking. And what's really interesting, we talk about the amygdala and airway, right? Hypoxia, the whole 9 yards. Amygdala and that emotion, how it's like that emotional part of our brain. What's really interesting is that in the airway world, we can have that kind of fear. The amygdala kicks in, we have fear. And then the frontal cortex kind of picks up and says, okay, things are better, things are better. What's really interesting is that we can actually trick our brain into not fearing fear. There's things that they do in the Navy SEALs, but in my world,
Uh-oh. You're skipping a little bit.
Is that better now?
Yeah.
But in my world, going through this program, it occurred to me, Renata, this one thing. I was trained not to feel fear. So through like battlefield nursing, survival training, where they like threw us out in the woods, I put us in a box for like 12 hours. All these exercises we have to do have trained us to let our the prefrontal cortex really take as far as rationale, thinking, and processing executive function. And we're trying to kind of shut off the amygdala. Well, think about that in children, because their little are so underdeveloped, right?
Yes.
And they can't really sense that fear. And I'll tell you, almost the worst feeling ever is not being able to breathe. That is almost the scariest thing, is not being able to breathe. The children. So I really got passionate looking at all these different things. And yeah.
You know what I heard today?
What?
There's this guy that I follow on Facebook. It's full of tattoos. He used to be a convicted felon, and he gave his life to Jesus finally. Whenever he was in prison, he read the Quran 3 times from front to back, and the Bible twice from front to back. And still that was not enough. It wasn't until after he left there that he gave his life to Jesus. But he said something today that you started talking about fear, and I was like, oh my gosh. He said the fear is the reverse of faith, is the opposite of faith. So it's having faith in reverse. Pretty much, if you fear something, you have faith that the bad thing is going to happen. And in the Bible, they talk about having faith like a child. And you just mentioned that children don't really have fear.
Yeah, they just don't have that fear because their neurological pathways are so underdeveloped. So think about the world. How long do they have to be hypoxic? And I call it slow airway or slow airflow hypoxia. Like nasal resistance is very cumulative. So think about that. Their little neural pathways are not very mature.
Mm-hmm.
And they're compensating to the point where they adapt. And the adaptation is what we really see in our clinic. The mouth breathing, the bedwetting. The problem didn't start a month ago, 2 months ago. It started long before that. So I'm talking to a dentist yesterday, the one who inquired about, rhinomanometry and myofunctional therapy. I'm like, do the services you can do for your patient, right?
Mm-hmm.
And Airway story. I'm like, well, he said, my own personal experience brought me into the Airway world. So tell me more story. And it was about his son. And his son became colicky 2 weeks after birth. Think about that. I mean, children, babies, because, and I say this a lot, and what I learned in the ICU, the PACU, and the OR is that children are not little adults. And that really drives me crazy when I hear that. I mean, they have a larger tongue related, in relation to the oral cavity. I mean, there are so many physiological changes. The nose isn't so protrusive, but they're very different than adults. And they already have high nasal resistance. I mean, it drops by the age, usually drops by 50%. So you can see how that growth pattern is affecting nasal resistance, pressure. Pressure drives our breathing, not flow. And I hear that a lot. And I really appreciated one of my readers reaching out to me last night. They bought book number 2, The Nose Decoded.
Yay! That looks awesome.
Actually, there's 63 nasal functions.
63?
There's 63 in here, y'all.
Wow.
So I go over the function. I have an introduction about the function. I go over the anatomy and physiology, the mechanism of that function, how it relates to the brain nervous system in that function, diseases that affect it, and how to prevent that function becoming a dysfunction. And one of my readers messaged me. He said, this is like a manual, like a car mechanic manual for a car. And it was really fascinating because this person, he's like, I really had no idea how intense this was. So I have the privilege of doing a talk is for ASAP pathways. I'm doing like neurorespiratory complex because, especially in children and how important this is. But so that's kind of what's been happening over the past, I don't know, while.
That's incredible. I mentioned Dr. Martha Cortez in the beginning. And if people do not know this, when I started Airway Circle, she was there from the beginning. And we started a podcast called Airway Circle Radio. And in Airway Circle Radio, since it was like a radio station, there were 3 different shows. And one of the shows was hosted by Dr. Martha Cortez, and it was called Beauty of Breathing. Yeah. So they did it for a while, and it was her and Jenny Hobson. And they did it for a while, and then I decided to stop all the podcasts and just keep one of them. There was Airway Answers by Nicole Goldfarb. So we kept Nicole's show only, and I stopped the other ones. And then all of a sudden, Dr. Martha Cortez unfortunately passed away, and nobody really knew when this happened. And I had all of a sudden in my heart to bring Beauty of Breathing back. And I kid you not, my first day, the launch day, was the day she passed away, and I had no idea. Did I?
And that was April 16th, 2024, she passed away?
Yeah, it was April. Mm-hmm. And that's the day I brought it back, and I was like, I found out way later from you, and I just could not believe that it was the day. I just felt it in my heart to bring it back, and it was the day she passed away. And I was like, oh my gosh. So I know that she's present still in our lives, and I just wish that we could get just a little tiny ounce of her wisdom, because she was so intelligent in so many different levels, not just in Airway, but in life. And I'm just so blessed to have known her and spent time with her and call her one of my mentors and friend, right?
Yeah.
For both of us.
She gave me my first opportunity at writing a book in July of 2022. I was already starting to write Breathe Your Nose, Don't Pay. And the reason I wrote it is I was just so frustrated with the whole medical system, the whole airway, what I was seeing on social media. And I used that one as a public education book to let people know, who are all these credentials? What's an LPN, RN, APR? What's a first year resident? What is an attending? What's a fellow? If you go to a hospital, there's all these different levels of healthcare, practitioners. Who's who in the airway world?
Mm-hmm.
And such $1 billion market. And I always say to my patients that, when they come to me and they say, well, I saw this on the internet. And in my mind, my amygdala flight nurse brain just shuts it off. Okay, stay off the internet. There's so many things out there, Renata, and I don't know how you feel about this, but I'm probably going to hurt some feelings because I'm good like that. But I'm going to be brutally honest. There's so much out there that who do you know to believe? And people are so, another doctor the other day, people are so desperate to breathe and sleep.
Yeah.
So who do you believe? And I want to hear your perspective. Because I'm in the airway world and I'm more in an advanced practice nurse role and healthcare policy, things like that. But but in your, I want to hear your perspective and tell the audience, what do you see? I can tell you the medical side of what I see, the ENT side. There's a lot of things in the ENT world. Sometimes surgeons are like, whoa, don't do this, don't do that. I mean, we really have to drill down and look at these sources, right? So I want to hear your perspective. What are you seeing? And over the past 5 years, it's grown ever since like COVID. Everyone talks about the nose.
Yeah.
I hear this a lot, and I'm going to just say it. When I hear so quiet breathing with no resistance, let me just stop right there, because we all have a level of or negative pressure breathing,
which is healthy. We need to.
Yeah. We have to have a little bit of resistance to slow that air down. Like in my world, we wouldn't do CPR and bag somebody in the cold because of what? Boom, like that, a bronchospasm. And one other thing too that I've learned through my functional medicine program was that there's a huge difference between respiration and ventilation. We can ventilate, we can push air in somebody, but if they don't, way down in the lungs at the alveoli level and the capillary level, if they don't have gas diffusion and perfusion, you're not, you know what I'm saying? And so I found that really interesting, the differences. Ventilation is just taking air in. Respiration is the oxygen exchange and getting into your blood so we can survive. Yeah. So I got off on a tangent, but anyway, tell me what you're seeing and your thoughts from the dental world perspective.
Of nose, they're still not looking at the nose. They still don't understand enough about the nose to even consider it. I wish the dentist understood the roof of your mouth is the floor of your nose. And every single time that you're making any skeletal changes to the maxilla, you're also making skeletal changes to the nose. And it's just important for us to learn more about it and have a great relationship with an ENT who we can collaborate with in these cases. But I believe that the prognosis of dental work would improve if dentists started looking at the nose also and making sure their patients can breathe. It's not simple. It's an extra thing that they have to do. Not sure if it's ever going to go somewhere, but I think it's important for us to start having this conversation. Now, in terms of who to believe, I feel like after COVID, people have really become their own advocates. And I think that that's the key, because you can walk into 10 different dental offices and you're going to get 9 different recommendations for your treatment. So it's not.
Why?
Why is that? Because of different schools, different training, different beliefs, different experience, different tools that they use, different products, because all of that is going to influence your decision. If you work for, well, I'm not going to go there in the corporate world, but I don't know. Yeah, I'm not going to say that, but I don't know. I think that people becoming their own advocates and doing their own homework is really what's helping them find the answers that they're looking for. Just going to one place, like right now, I'm looking at my blood work and I'm having 3 different functional medicine doctors look at my blood work to help me. What's the next step? You may be the 4th.
Fourth one.
Yeah, because, one person looked at me and told me something, gave me 20, 15 different supplements. And then somebody else looked at it and gave me a different diagnosis. So who do you believe? You want to believe and to have something to follow. So I feel like the more people study themselves, the more they read research, the more they find ways, or even this podcast, to find easy digestible ways of learning more information. We're always learning. Things are always changing. It's the best way for us to find our own answers. It's not one treatment and one answer that's going to be good for everybody. You tell me.
Yeah, it's really important you bring that up. And I'll tell you one thing I absolutely love. And I'm going to give a shout out to Emma Cooksey, because she has been such a huge advocate for CPAP.
Yeah.
And as long as I've been in the medical world, in the sleep world, and full disclosure, I used to work for Innomar Medical, and I used to sell the watch pad and the EndoPad. And I love the watch pad. But I think she has such a huge voice and is such a level of reason. Like, she's Switzerland, when it comes.
Yeah.
And I love that. And I remember when I worked in children's mental health back in the mid-90s in North Dakota, we really got things moved. One of my families, the mom was just so fresh in schools, trying to get accommodations and things like that, regardless of the amount of documentation she had. She went to the state. So we all, I support her. We all went to Bismarck, and she got things done for kids diagnosed with ADHD in the schools. And it was really fascinating, and really 04s didn't really come around until later. Even the Vanderbilt assessment, and I highly recommend that if somebody says that your child has ADHD-like behaviors, or you suspect them yourself, meaning they're inattentive, not just 1 day or 2 days, but you see this for month after month after month, performance issues in school. I want people to look this up. It's called the Vanderbilt Assessment Tool.
Okay.
It came out, I think, in 2000. Came out. I talk about it, I think, in either book number 1 or 2. I can't remember. But it's a really valuable tool. And what that does is it gives the parents' perception and the teachers, and they put those perceptions together to create either a 504 plan or an IEP, which is an individual educational plan for that particular child. Take advantage of those resources, especially in the public schools. Use the guidance counselors. That's their advocate as well. So I love parent advocates, and shout out to the ones that do this and really share their own experiences. But you're right, everyone's individual. Like nasal resistance, everybody has their own level. There's over 500 variables I have found that really impact resistance. So we can't say, okay, you have a vaulted palate, nasal resistance. No, it's bigger than that.
Wow.
It's much. Yeah. So, yeah.
I have so many questions about nasal resistance.
Okay.
You often say we don't just breathe, we breathe against nasal resistance. For those who have not heard that before, what does that actually mean? And why should clinicians care about the resistance required to breathe?
Yeah, so nasal resistance and nasal function, they're different from breathing. Nasal breathing is the habit. That's the actual behavior. Nasal breathing is a behavior. Nasal function and nasal resistance are mechanisms. So we're negative pressure. As soon as we take an air in, the negative pressure in our chest cavity pulls that air in down into the lungs. There's a few things that happen. We have humidification. So at each point, from the time the air goes in the nose to the time it goes to this level in our neck, there's a relative humidity change. So you can see how the air humidifies as it comes down into the lungs. If the air moves too fast, it doesn't get those accommodations of humidity and filtration and things like that. So we talk about the main characteristics of the nose: warmth, humidification, things like that, filtering. But there's more to it, as I talk about in the Nose Decoded. And we also want to look at nitric oxide production. We want that nasal function and the nasal resistance to slow that air down so that we have the nitric oxide production. Now, here's one thing that I hear on social media when they're like, the nose produces nitric oxide. Well, not the nose itself, it's the paranasal sinuses. But they do produce it, but it's actually your endothelial cells in the vascular system. Your blood system is what produces most of your nitric oxide. The highest concentration of nitric oxide, so not the amount, but the concentration happens in the paranasal sinuses. So there's and in my world, like in my old trauma days, nitric oxide can actually be produced by the gut and the liver when you bleed out. Another fun fact. It's in book number 2, another nasal function.
Wow.
So that's the difference. I mean, we have to breathe against that resistance and those pressures to slow the air down so that the air can warm, humidify before it gets to the lungs, because we don't want bronchospasm.
So can someone feel like they're breathing perfectly well through their nose and still have abnormal nasal resistance?
Absolutely. Yeah. So I want to clarify another thing too. Pasuli's law, which talks about the radius to the 4th power to the 16th power. In my world, for nasal function, nasal resistance, we don't use that. We don't. The nose is not a tube. It's a pressure regulating organ. And it's a resistor as well. So in our world, for nasal function and nasal resistance, we use the Starling resistor model, which is a cardiology theory from way back when. We use Bernoulli's principle that talks about the speed of air coming in and the velocity of air coming in. And more importantly, we talk about the Weber-Feichner law. Now, the Weber-Feichner law, to your question, a patient can feel like they're breathing well, but not responding to the stimuli. So if we go back, and Dr. Klaus Vaught taught me this, that the Weber-Feichner law is that our perception to breathing can be actually different than our actual action of breathing.
Wow. I got to digest that one. One of the things that makes your work so unique is your emphasis on objectively measuring nasal function. Why isn't it simply looking inside the nose or asking a patient, can you breathe through your nose? Why isn't that enough?
Yeah, and that's a great question, because a lot of times everybody looks at the nasal cavity. They look at how wide they make the nasal cavity. But here's the misnomer. A wider nose does not mean
better function.
A wider nose does not mean better function. And this was presented in the European Rhinology by Kern, who's one of the big names, along with Maurice Cottle, Maneuver, and of course, Klaus Vaught and Peter Clement, a lot of these different big names in rhinology. But what's really interesting is, sorry, my phone was going off there. What they said was that when you expand and you make that nose bigger and bigger and bigger, it's not so much the air moves faster or whatnot. The body will compensate, and that pressure gradient will kind of like move. So we have a certain amount of pressure in our nose, a certain amount of pressure in our oral cavity, pharyngeal cavity. And when you adjust pressure, you adjust all pressure. So it's kind of a domino effect, right? And we have about 8 to 10 pressures in our body to help us. We have about 36 to 40 total pressures in our body.
Wow.
I mean, we have abdominal pressure, urinary pressures, uterine pressures. I mean, all these pressures keep things moving in our body, right? Even in our blood system, we have higher pressures. Blood pressure, right? One thing we use in the critical care world was arterial pressure. And we use what's called a line that goes like right into the radial artery. And that's where we can get a lot of our blood to check blood gases. So to your point, we can look at the structure. That's great. But 1 millimeter of change in structure, the skeletal structure, can have a complete difference in.
Uh-oh. We're skipping. We lost her. All right. Well, I know she's coming right back. However, we were talking today and we said, let's make this a quick 30-minute and we're going to have her back. So maybe this is the perfect time for us to end. I had one more question before we were going to be finished, but let's just go ahead and end right here as we're talking about. My next question is going to be about 4-phase rhinometry.
The phone is going off. Sorry about that. Can you hear me okay?
Yes.
Uh-oh.
Finish. Go ahead. Finish your thought, and then I have one more question. We're gonna.
I can't hear you.
Uh-oh. All right. It's probably because your phone rang.
I can't hear you. Oh my gosh.
I know. All right. Thank you, everybody. Thank you, Dr. Karen, for being here. Guys, catch part 2 of this episode. It always comes out on Tuesdays. It's going to be on Instagram, on Myo Moves Instagram, and on Beauty of Breathing podcast platform. Thank you for being here and listening with us. We'll catch part two next time. Thank you so much.
I can't.
Thank you. Bye. Thank you for joining us on another insightful episode of the Beauty of Breathing podcast. Make sure to join the conversation on our Instagram page, Myo Moves, and continue exploring the fascinating world of airway health with us. Until next time, let's breathe deeper, live fuller, and discover the beauty in each breath. Quick disclaimer: the Beauty of Breathing podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult with your healthcare professional for any medical questions.